Well, I'm delighted that you're interested in the mental health track. We have a severe shortage of mental health providers, both in South Texas and throughout the United States. What we know is that about only 2/3 of people who need services are able to access services, and a big part of that is a shortage of psychiatric mental health providers, particularly psychiatric mental health nurse practitioners, because psych mental health nurse practitioners function very similar to psychiatrists, managing medications, providing psychotherapy, treating individuals, families, and communities. And our program prepares people to do all of that and more. What is unique and what you will find is that we have a diverse set of clinical experiences for students that carries across the lifespan. So children and adolescents, adults, and geriatric clients. We also have a personal relationship with our agencies and those who precept our students. We don't expect our students to go out and find their own preceptor. We have a clinical liaison who works intimately with the course coordinators and the students to find the right match for the student and the practicum and the agency so that they can come forward with a diverse, rich experience. Our students are exposed to the lifespan in part because we live in a very rich community in San Antonio where we have access to child adolescent psychiatrists, board certified adult psychiatrists, board certified geriatric psychiatrists, and all of those are committed to providing our students with a rich exposure to these separate populations, and our students have the opportunity to identify which age groups that they have an affinity for working with, and to focus on those. So in San Antonio, we're very lucky to have that. Not all programs have access to those kinds of specialties. For many years, mental health has been carved out in the sense that people have felt either I have a physical illness like diabetes or heart disease, or maybe I have a mental health problem. But the fact is that the mind is not a separate organ in the body. The mind is part of the brain and the entire organism. So thinking about the human being as a whole, rather than compartmentalizing it and thinking, well, mental health is over here and physical health is over here, that's really an artificial notion. And we see that and we teach that, especially in illnesses, for example, like autoimmune disorders, cardiovascular disorders that also have a mental health component. So the program brings to the student a broad knowledge of pathophysiology, of psychology, of medication management, and psychotherapy so that we can provide and understand the whole person. So the capstone projects are typically where a student identifies a gap or a problem in a clinical setting, and they search through the evidence to find something that can make a positive change, and then they implement it, and then they evaluate that and determine if this was successful. And if it was successful, how can it be replicated in other places to enhance care? One capstone project that comes to mind is a student that was working with Dr. Marta Vivas, and she was working in a military system, and she was able to implement and integrate the use of a depression screening instrument called the PHQ-9 across multiple settings in the military healthcare system. This was so significant that she won a national recognition award for the implementation of this, which will be able to be reproduced in other settings. So that's just one example of the terrific work that our students are doing. I'm very pleased to say that we provide a very diverse experience in our clinical practicums, and we provide that across the lifespan. So our graduates have had both didactic and clinical experience working with children, adolescents, adults, and even geriatric patients, which provides the full lifespan. And in addition to that, our practicum sites are diverse. They are all over South Texas, as far south as Corpus Christi, to the southwest in Laredo, in the greater San Antonio area. And so we have a rich, diverse client group, and we have a diverse population in terms of those who precept our students. So students graduate with an appreciation for diversity and uniqueness, and they graduate with a flexible way of thinking. So students who are successful in this program have skills that allow them to prioritize and to manage their time wisely, because the volume of work is significant, including reading as well as writing. Now, that being said, we have a significant support system within the school in the Student Success Center. So there are writing coaches, there are people that can work with our students, our doctoral students, to be successful in every aspect, not only in preparing for exams, but also in writing and writing well. I think the personal attributes that bring a student forward and allow them to grow in this program are individuals that have compassion in their heart, individuals that can be patient with their patient population, and individuals that want to break the stigma. So students that bring forward compassion, patience, and the desire to break through the stigma of mental illness, to assist people in recovering from a mental illness, that's really the essence of what helps the student be successful in the program. That's the goal, is to get to that place where people are working on publications as they go forward, and right now we're even looking at how that might be the case for both doctoral programs. Choosing a Doctor of Nursing practice program is more than becoming a nurse practitioner. It's becoming a nurse practitioner with the skill set to be able to identify and address issues at different systems levels, to affect policy. And that's so important in psychiatric mental health because of the fact that there's stigma and because we have an inadequate supply of mental health providers. So this is really a powerful program because it provides the tools to take care of individuals, families, and communities, and address systems issues.